Hey, Miles.
Hi, Matt.
How are you?
I'm good. I'm stressed. I'm about to take my first EMT exam.
Well, you shouldn't have to worry because we made this great video to walk you through how to properly take the National Registry of EMT psychomotor exam.
Oh, thanks, us. I appreciate that.
No problem, us.
The NREMT psychomotor exam is often one of the most stressful components of EMT training. But with careful preparation and well-informed practice, you'll be able to breeze through the exam with confidence. When it's your turn to perform this station, you'll be invited into the exam room, and the examiner may give you a few moments to familiarize yourself with any equipment you might use before you begin. After, your examiner will read you a prepared statement giving you the exact information you need to know to perform the test.
All right, Miles, are you prepared for the trauma assessment portion of your NREMT psychomotor exam?
I think so.
I'm going to read you some instructions here. Please listen carefully. If you have any questions, I can answer them at the end. This station is designed to test your ability to perform a patient assessment of a victim of multi-system trauma, and you're going to verbalize all treatments to conditions and injuries discovered. You must conduct your assessment as you would in the field, including communicating with your patient. As you conduct your assessment, you should state everything you are assessing. Clinical information not obtainable by visual or physical inspection will be given to you by me after you demonstrate how you would normally gain that information. Does that make sense?
Mm-hmm.
You will assume that you have 2 EMTs working with you that are correctly carrying out any verbal treatments that you indicate. You have 10 minutes to complete the skill station. Do you have any questions?
No.
All right, you may begin. Miles, you are dispatched to a trip and fall. Someone fell off of a staircase while trying to change a light bulb. It was called in by a bystander who witnessed the patient fall down. They are reported to be unresponsive.
All right. BSI, scene safe.
Scene is safe.
Okay. Appear to have one patient, mechanism of injury, fall about 15 feet. Based on mechanism, I would like to request additional resources, and I'm going to consider C-spine precautions, directing one of my assistants to move the head into a manual inline position, direct my other assistant to place a C-collar at this time.
Head is now in inline neutral position.
Okay. General impression, female, supine, poor, appears to be unresponsive. I don't see any apparent life threats.
There are no apparent life threats.
Okay. I'm going to assess her mental status. Ma'am, can you hear me? Can you hear me?
No.
Patient's response to painful stimuli. Yep. We're going to keep your head in a neutral inline position. There we go. All right. I'm looking, listening, and feeling for breathing. I'm looking in her airway. Here we go. Airway
She is
appears to be.
breathing, airway is patent.
She's breathing, airway is patent. I'm palpating a strong and regular carotid pulse that appears to be normal in rate. Is that what I find?
Her pulse is rapid.
Rapid
and
pulse.
Strong, correct.
Okay. I'm going to initiate oxygen therapy, 15 liters per minute via non-rebreather mask to assure adequate ventilation. I'm going to manage any injury I find with the airway.
Patient accepts non-rebreather.
Okay. Seeing equal chest rise. Do I see any major bleeding?
You do not see any major bleeding.
Patient appears to be warm, pink, and dry.
Patient is warm, pink, and dry.
All right. I'm going to call this a high priority transport. I'm going to direct one of my assistants to obtain a set of vitals and get a sample history from any bystanders or family. And I'm going to perform a rapid trauma assessment.
Copy that.
Okay.
Your vitals that your partner finds are a blood pressure of 110/70, heart rate of 120, and a respirations of 22 and weak.
110/70, 120, 22 and weak. All right. Inspecting, palpating the head, looking in the ears. I'm noting battle signs and raccoon eyes, looking at the nose, mouth, feeling down the neck, JVD and tracheal deviation.
Are not present.
No. I'm going to inspect, palpate, auscultate the chest.
Equal lung sounds and chest rise.
What'd you find for lung sounds, Matt?
Equal lung sounds and chest rise.
Okay. Palpating all 4 quadrants of the abdomen. Looking for distension, rigidity. Pelvis. I want to verbalize assessing the genitalia and perineum. Do I find anything there?
Nothing in the genitalia or perineum.
Okay, we'll move on to the extremities. Patient groans there. Looks like I've got obvious deformity and an open fracture.
Open fracture on the lower left tip.
There's some bleeding. It appears to be minor.
Minor bleeding.
I'm going to take note of that and return to it later. Okay.
Equal CSMs on the upper extremities.
Gotcha.
CSMs are present, slightly diminished on the left extremity.
Slightly diminished on the affected leg. Okay. So, high priority for transport. I'm going to package this patient on a backboard. We're going to mobilize that leg in the process of backboarding, and then we'll pay more attention to it in the ongoing assessment. But I'd like to package and transport to the hospital now. And then we're packaging to a backboard. I'm going to assess their posterior.
You find nothing on the posterior.
Okay. High priority, I'm going to reassess vitals every 5 minutes and perform an ongoing assessment, try and refine treatments, and go into more detail on the way to the hospital. But unconscious, responsive to painful stimuli, I'd like to get on the road.
Copy that. Anything you want to change or add to your trauma assessment?
No.
All right, thank you very much.
Before you complete the station, your examiner will give you an opportunity to make sure you didn't forget anything by asking if there's anything you'd like to change or do differently in the test. This is your opportunity to take a quick second to review your performance and verbalize anything that you think you might have omitted, missed, or would like to do differently.